Mike Boyman, and welcome to the chapter, A Difference in Opinion, Managing Issues Occurring Due to Expanded Scope. Upon completion of this module, you'll be better able to A. Review how a difference in clinical opinion is not an error. B. Discuss how gray the pharmacy world has become. C. Determine how to make clinical choices that are in the best interest of the patient. And D. Develop strategies to reduce the risk of errors when providing expanded services. So let's start by looking at a patient case. Our patient Kelly Jones is in to see you. She has type 2 diabetes, and you have been providing her education and counseling regarding her diabetes over the last few months. When you were checking your logbook, you've noticed that her SMBG readings have been generally high, and you're concerned. You asked her to have her physician provide the last few A1C readings. When she brings them into you today, you've seen her last result was 8.1%. And over the last year, she's had a couple of results that have been between 7.9 and 8.4. She's been taking the same diabetes regimen for the last year and a half, and is currently taking metformin 1000 mg BID and gliclazide MR 30 mg daily. You feel the patient is at risk of complications due to her diabetes, and you adapt her gliclazide MR prescription to 60 mg daily. Kelly agrees with this change and will start the higher dose tomorrow. You would normally do a pharmaceutical opinion, but it's a Friday afternoon, and you want Kelly to start this regimen ASAP. You fax the information about the adaptation to her family physician. When you come back to work on Monday, you receive a call from Kelly's doctor. He's really upset. Kelly had a hypoglycemic reaction this weekend and has been calling him to find out what she should do. He feels that you second-guess his clinical judgment. He also tells you the patient is wondering why you would make a change that would cause this type of problem.
Good afternoon, ABC Pharmacy. This is Iris speaking.
Are you the pharmacist?
Yes, I am.
Good. Well, I have a major concern. I just got a call from one of my patients, Mrs. Jones, and she's not doing very well. It seems that you or someone at your pharmacy has told her to double her dose of gliclazide, which has caused a hypoglycemic reaction. Now, I don't know why you think it's okay to just change my prescription, but I really don't like being second-guessed.
Oh my goodness, I'm so sorry this has happened. And yes, I did tell Mrs. Jones to increase her gliclazide dose.
Seriously? You know, I've been treating Mrs. Jones for a number of years. What compelled you to just change my prescription for this patient?
Ask yourself these questions. Should you have made the change? Was this the right choice for the patient? How would you manage this physician phone call? Would you call the patient afterwards? And what would you say? Would a situation like this hinder you from doing this again in the future? The practice of pharmacy is drastically changing, and pharmacists are expected to make more clinical decisions for their patients. If you look at the expanded service that we have in Ontario, such as extending or refilling prescriptions, adapting prescriptions, or future services such as minor ailments or pharmacist prescribing, you can see that we're going to be expected to make clinical decisions more often. You are responsible for the changes that you make. And this is a drastic change in terms of pharmacy practice because you are initiating something instead of being told what to do. You can see this is very, very different from dispensing. Clinical decisions involve you making a decision for what you feel is in the best interest of the patient. This is very different from dispensing. With dispensing, there are hard, fast rules that you must follow to ensure the legality of a prescription. There's really not room for judgment in terms of prescription filling, and what you do with one patient is almost the same that you do for almost every other patient. It's consistently black or white. There's no room for interpretation, whereas clinical decisions are completely different. Many times there are at least 8 different paths to get to the same results, and all of them are okay. Think of A1C. If you look at the Canadian Diabetes Association guidelines, they recommend a variety of different therapies to reach a patient's A1C goals. All of them work, and all of them are effective. It's not black or white. It's an area of gray. The decision for therapy must be customized for the individual patient. What you do can be very, very different from that of another clinician. Or in the dispensing world, what you do is pretty much consistently the same as any other pharmacy in the province. So let's talk about dispensing errors for a second, and why they're so different from a clinical judgment error. The Ontario College of Pharmacists has this great protocol for pharmacists to follow if they make an error. This chart demonstrates this process. Simply put, if you make a mistake, you follow the flowchart. It's clearly black and white. You go from one step and then to the next. With clinical decisions, they're completely different because you're making a judgment call versus an error. Each case is unique, and the decision that you make is individualized for a specific patient at a point in time. What's amazing is that a judgment call that others may disagree with may not be an error at all. So for example, if we take a high A1C reading, you may decide to use one medication to get a patient to an A1C target, but another clinician may use a completely different way to get to the A1C goal. Both are okay, but both clinicians will consider their choice as the optimal one. Although this is just a disagreement in clinical decision making, the other clinician may feel that the other one made an error. Differences in opinion may not be an error at all. So let's talk about clinical judgment errors. And what we're seeing from some pharmacists is that a fear of mistake is actually crippling their clinical judgment. Some are so scared of making a mistake or getting in trouble that it's significantly hampering their ability to do anything for their individual patients. I've heard from some pharmacists who say that it's so much easier just to do nothing. Well, I always tell them that doing nothing is also a clinical decision, and you're going to be accountable for that decision. So if someone comes to you that should have been taken care of using your standards of practice and you didn't, well, that's a clinical decision, and you'll be accountable for that decision. But what you have to remember is that for most cases, there's not a perfect answer. So what you can do can be very different from another clinician. And in Ontario, with the lack of access to clinical values, you are sometimes making a clinical decision without all the information that you would like to have. Let's look back at our original patient case, and many of you may be wondering if it was a right choice for our patient. Well, let's look into the case. She has poorly controlled diabetes. Her fasting blood glucose readings have been consistently above 8, where the target is typically between 4 and 7. This places her at higher risk of complications due to poor glycemic control. If you look at the current CDA 2013 guidelines, she's not being managed according to the current guidelines or to the standards of practice. What you have to think to yourself, would doing nothing have been a better option for this individual? So what you have to remember when you're making clinical decisions is something that I say all the time. It is all about the patient. So based on the information we know about this patient, you had to do something. She's at high risk for complications from her disease. She's not being managed according to the standards of care. She's not being managed according to the guidelines. If you did nothing, would she have better long-term outcomes? Well, no. So it's better to do something. What do you do now? It's important that you find out as much information as you can. You have a physician on the phone, and it's a great opportunity to get as much information as possible. A statement you could use with a physician could be, "Thanks for calling. My goal is to ensure that patients are reaching their health targets. I had a conversation with a patient prior to the change, and we both agreed that this was right for her. I'm going to give her a call and find out more information. Can I call you back after I talk to her?" Let's see how our pharmacists interact with a physician.
Well, I'm very sorry you feel this way, Dr. Smith. However, I've been working very closely with Mrs. Jones over the last few months to help her get her diabetes under better control. I've had her testing at a variety of different times during the day, and her readings consistently were above target. So we adjusted her diet and her lifestyle, and even then she was above range. So when she came in to the pharmacy on Friday, she had all her latest A1C readings for the past year, and they were all high. Her most recent one was 8.1%, and we really had a good discussion about what could we do to improve her glycemic control. And we decided that increasing the glycoside was a good option, particularly because she's still well below the maximum daily dose.
She agreed to this. I remember talking about a year ago with her about changing her medications, but she refused.
Yes, she did agree to it, and as I said, I've been working with her closely, and in this case, I made the suggestion to make a change in her medication, specifically to increase the glycoside.
Why wasn't I informed about this change?
Actually, I did notify you. When she came in on Friday and we had this discussion, she wanted to start the new dose right away. I called your office. I wanted to speak with you, but you had already left for the weekend. So I faxed you a note about this change. You know, it's important for me to keep you in the loop about our mutual patients and changes in their medications. Did you get the fax?
I haven't been brought anything.
Well, you know what? I'd be pleased to fax it over in the next couple of minutes.
Sure.
And you know, Dr. Smith, it was not my intention at all to second guess you. This decision was based on our conversations with Mrs. Jones over the past few months. You see, I do a fair bit of diabetes education in my practice, and my goal with diabetes management is to help patients meet their treatment targets to prevent the risk of long-term complications. Is there something you would prefer that I do differently next time?
Well, I think I'd rather you call versus sending a fax. There can be specific issues with some of my patients. Like in this case, if I'd known that her A1C was 8.1, I would have done something.
Well, I'm definitely not trying to replace the excellent care that you provide to your patients, but with the new expanded scope of practice for pharmacists, I'm able to work with patients to help determine their treatment targets and discuss different options available to them. And in this case, yes, I did recommend an increase in the glycoside dose, so I do take full responsibility. I'd like to call Mrs. Jones and talk to her just to see exactly what happened. Can I follow up with you and let you know?
Sure.
Great. Well, I'll be in touch. Thank you so much.
Okay, thank you.
I would also recommend that you contact the patient. Here is something that you could say to her. Sorry that this happened to you. Can I ask you a few questions about what happened so we can look for the best solution?
Yes, and Dr. Smith said that you were experiencing some problems with the change in medication. Can you tell me what's happened?
I felt awful this weekend. Tired, nauseated. Plus, got a cough and sore throat, dizzy. I feel sore all over. I don't think I can take much more of that diabetes pill.
I'm sorry that you feel this way, and it sounds like you're really sick. Can you tell me a little bit more about how you're feeling?
I had a bit of a fever, but it seems to be gone.
And have you been testing your sugars during this time?
I just don't feel up to testing. I don't think we should have made the change without talking to Dr. Smith.
Well, based on what you've told me, I'm not convinced that it's the change in medication that's making you feel this way.
I'm sure it was the medication. Nothing else has changed.
Okay, so why don't we do this? I'd like you to reduce your prescription back to your original dose. I'd like you to test a little bit more frequently over the next couple of days. I think you may have developed an infection.
I guess so. I'll test a few times today. How long will I feel this way?
Well, I think you'll probably feel better in the next couple of days. I'm going to call you tomorrow and see how you're feeling. I'd also like to call Dr. Smith and let him know how you're feeling as well. Would that be okay with you?
Sure.
And once you're feeling better, I think that's when we can sit down and talk about other options to improve your diabetes. But for now, I really think I'd like you to focus on getting a lot of rest and relaxing.
That's all I feel like doing.
And I'm in the pharmacy all day today, so if you have any other questions, don't hesitate to give me a call.
Thanks. I appreciate that.
Okay, so I'll talk to you tomorrow.
Bye.
Bye-bye. Take care. Yeah, so based on our conversation, it sounds like she's developed an infection. She says that she's got a sore throat, she's feeling tired, she's got a cough, and she's developed a fever and overall body soreness.
That doesn't sound like a hypoglycemic reaction.
I agree, but she is convinced that it was the increase in the glycoside tablets that has caused her to feel this way. So I told her to reduce back down to the original dose and that I would call her in the morning to see how she's feeling. I also told her that we're not going to do anything else about her diabetes control until she's feeling better.
I had another look at her chart after our initial call, and it looks like I gapped it. I'm thinking of starting her on a DPP-4 inhibitor to get her blood glucose under control.
Oh, I think she would be okay with that. As I said, she's very motivated to get her diabetes under control. Would you like me to refer her to your office when I call her tomorrow?
That'd be great.
Okay, and Dr. Smith, if there's anything else that I can do for Mrs. Jones or for any of our mutual patients, don't hesitate to give me a call.
Sure thing.
Okay, thank you. Bye-bye.
Thank you very much.
Remember, everything points to the problem being due to the change in your medication, but it's important to remember that it could have been unrelated to your intervention. Don't go in feeling guilty. It's about finding out all the information that you can to reevaluate the patient's case. Another piece of advice that I can give you is to not make assumptions. The issue may in fact not even be a problem for this individual patient. The issue could have been a single patient error, a patient perception issue. She may just felt like she was hypoglycemic, but she didn't check her blood glucose, and she may not have been. She may have just felt a little bit off. Or it could have been one issue at one point in time. We have to remember that a short-term problem may not be a long-term issue. This is important if we look at all the things that we are monitoring on a regular basis. We don't assess overall blood pressure control by just one reading. We always look at a pattern of readings. We have to remember that people are not constants. They vary from day to day. So what might be an issue on one day may not be a problem on another day. So another point that I want to add is you have to be confident in the decisions that you make. Remember, what you're doing is in the best interest of the patient. You're making a clinical decision with all the information that you have at a specific point in time. So what I would tell a patient when making a clinical decision is, based on what you've told me and the information I have, I would recommend that you can see that what we are doing is engaging the patient and involving them in the decision. This is crucial because about 90% of health decisions are made by the patient outside of the healthcare professional setting. So we need to engage them and involve them in the process of any change that we make. When we're making clinical decisions, it's all about confidence. And how do you build confidence? Well, I would strongly encourage you to get more education. Certification in disease states such as Certified Diabetes Educator, Certified Respiratory Educator, and Certified Geriatric Pharmacist can all end up helping to build your confidence in the terms of the way you manage your patients. This is where continuous professional development really plays a strong role. Don't ever settle with just meeting the standards of practice. Strive to exceed them. Really try to focus on areas that you don't know. I see a lot of pharmacists doing continuing education based on what is available versus seeking information they may not be sure about. Remember, you don't know what you don't know. The more information that you have, the better the clinical decision making that you're going to actually be able to do. So I'm going to tell you today is that you need to know that you're going to make a clinical mistake in terms of your decision making. And it's okay, and you need to accept this. You'll make a judgment call that may not be the best path to follow. And I would always say that it's better to try something, showing that you're doing something for the patient and that you have their best interests at heart versus just sitting there and ignoring the problem. So what do you do if you make a less than optimal clinical decision? Well, you need to learn from that situation. Think about it for a second. What would you do differently next time? Was it because of the specific patient, or was it more of a global issue? Was it a lack of knowledge? Did I not have all the information that I needed? Was I confident enough in the decision? Do I need to get more continuing education on the topic? And looking back, would you have done something differently? You still should have done something. Maybe it's just a different path to follow. So one of the most effective ways of reducing your chance of making a clinical decision error is focusing on your continuing professional development. I can't tell you enough how important it is to keep as current as possible. And I know how challenging this is. We all have busy lives, and there is so much new literature that is being constantly published. What I would tell you is don't worry about research articles, really focus on the guidelines, and really tackle the guidelines on conditions that you manage on a consistent basis. So there's some great resources that are available. For example, the Canadian Diabetes Association has their guidelines.diabetes.ca website. The Canadian Cardiovascular Society has a variety of different guidelines published on their site. The Canadian Thoracic Society, Hypertension Canada all have additional guidelines that are available free of charge and are readily available on their sites. What is amazing is there are so many different tools through these associations. They have mobile tools and online resources and calculators that you can readily use in your clinical practice. This allows you to make better clinical decisions for your patients. Once you read these guidelines and become more confident with them, you're going to know that there are many patients that you can impact with your clinical judgment. I can tell you from personal experience that the more CPD that you do, the more you realize the care for many patients is suboptimal. And the more that you can see the role of the pharmacist starting to evolve to manage these patients. If we do this appropriately, pharmacists can fix the status quo of patient care and help to ensure that all patients reach optimal health outcomes. So another way that you could actually reduce your risk of errors is to document. You need to document consistently and regularly. And if we look at other healthcare professionals that have to make clinical decisions on a regular basis, such as physicians, the lack of documentation can sometimes play a major role in many of the disciplinary cases that we see in medical practice. So it's important that when pharmacists start to make these clinical decisions, that they document their decisions appropriately. You have to remember that it's not about justifying what you did today. It's actually looking back at the note and justifying what you did a year from now, or several years from now. You have to make these notes clear and consistent. A lot of pharmacists get really worried about documentation, and some of them try to write a book. And this is not very helpful either. A, we don't have time. And B, it really doesn't add any more than a clear and concise note. So really what you should be focusing on is what you know, why you made the clinical decision, what your expected result is from that decision, who is responsible for what, so what are you going to do, and what is the patient going to do, and what is the physician going to do, and lastly, who's going to follow up with the patient. And when you are documenting, think about if you were reading another person's note. You would want it to be clear, concise, complete, and you want the note to make sense. What you find is the more that you end up documenting your activities, the more comfortable you become with it, and the more efficient you will become at documenting exactly what you need to put down in each individual patient case and patient decision. So another way that you can actually reduce your risk of error is looking at developing a collaboration and support network. There's absolutely no way that you can know everything. So you need to learn how to collaborate with other healthcare professionals, be it other colleagues like pharmacist friends or physicians. And it's not about a turf war, but all about improving patient care. Remember, no single healthcare professional, be it physician or pharmacist, can do everything. And if you look at what's coming down the pipe, patients, payers, and colleges are expecting better cooperation and collaboration. Remember that with each clinical decision you make, you are advocating for the role of the pharmacist as a clinician in improving outcomes for the patients that we serve. I'd also recommend looking at developing a group of colleagues to support you if you have any questions or want a second opinion. And this doesn't even have to be locally. You may have friends that you connect with through social media or email. This helps as you won't feel that you're standing alone on an island, that you're actually getting some support so you can make the best decisions for your patients. One crucial thing that you can do to reduce your risk of errors is to listen and not make assumptions. It's amazing how poor listeners many healthcare professionals are. We often don't listen to the patient. We assume it's a specific diagnosis as soon as we hear it, and then what happens is that we focus all of our attention to prove that our assumption is correct. And this by itself is a major reason for errors and is very poor patient care, because we're not understanding what the true problem is. Bad clinical decisions are made by assuming something without gathering all the information. So important that you listen to those individual patients and gather all the information that you need to make the best possible decision. But I warn you, too much information can be just as bad. It's amazing how many times that we ask for everything and then we focus on minute details and we start to micromanage a patient. This is a problem too. I would encourage you to involve the patient in any decision that you make. Discuss why you think something is a problem and why it needs to be changed. Review what you guys are going to do together, so it's again focusing on collaboration to address a specific issue. Then finish it by looking at what your role is going to be, what the patient role is going to be, and making this a positive change. By involving the patient, you are engaging them in the process. It's also a gut check to make sure you're on the right path and to let them know you have their best interests at heart. Plus, you're going to get their buy-in and increase their chance to be adherent to the changes that you recommend to improve their overall health. Let's reflect on the situation. Do you feel the pharmacist in the video managed the situation correctly? While viewing the video, would you have done something differently? Was this the right choice to make for the patient? I like to finish up my presentations with some quotes for you to think about. Here are 3 quotes from Albert Einstein, Benjamin Franklin, and John Wooden. I think that Albert Einstein sums it up the best when he says, "Anyone who has never made a mistake has never tried anything new." So I strongly encourage you to start making decisions and not worry about making a mistake. Really make sure that your decisions are always in the best interest of your patients, and focus on the role that the pharmacist can play in improving the health of our patients.